we're talking about recovery after uterus removal surgery. Now, if you've had uterus removal surgery recently or thinking of it, this video information is for you. All the patients are always worried about the recovery period more than the surgery itself. Recovery after uterus removal surgery may differ individually, but also depending on if you had a laparoscopic or abdominal surgery. Now, this is a guide on what to expect after surgery, keeping in mind each person is slightly different. Hi all, I'm Dr. Deepti Asthana, Senior Gynaecologist in Fortis Hospital, Gurugram and Director of Kalosa Clinic. Now follow my channel Kalosa Gynae for more videos shared related to female gynae issues, and follow me on other platforms like Instagram. You can also reach out to me through my website drdeeptiasthana.com or kalosa.aesthetics.com. Now let us see what to expect 24 hours after hysterectomy. Now most anesthesia effects wear off quickly. However, you may feel sleepier than usual. After surgery, discomfort and mild to moderate pain are common. Now in hospital, pain medication will be administered to keep pain levels low. Your tummy may feel bloated due to medications and lying still. Now, early ambulation is the key to early recovery. After 18 to 24 hours of rest, you should start ambulating unless told not to do so by your doctor. The doctor will allow diet as per the movement of your bowel as assessed on examination. Now, diet is started gradually, starting from water, liquids, and then the soft diet. A normal diet can resume after surgery if you've passed flatus and motion. Now, it usually takes 2 to 3 days. Now, you should be able to take shower 2 days after your procedure. Now, for laparoscopic or robotic surgery, patients generally go home early in 1, 2 or 3 days, and open surgery patients go home after 3 to 4 days in hospital. Now when you leave the hospital, you will be given instructions about wound care, including information on bathing and showering and when to take your medications. Take prescribed antibiotics as directed. Now also take prescribed pain medications regularly for at least 1 week after discharge from hospital, as it is much easier to maintain a pain-free state than to fight pain. Now at home, you can go to washroom on your own and walk in your house for the first week. A follow-up appointment should be booked 1 week after surgery to make sure you are healing correctly. Now 1 week after hysterectomy, your dressing is usually changed and you are assessed for pain, urine and bowel movements. For weeks, which can sometimes persist for months, bowel function could be impaired because of surgery and pain medication. Now try natural fibers and natural yogurt first. Laxatives may be required or prescribed prior to discharge. Now caring for your surgical wound. Now dressing is usually changed or removed 1 week post-surgery. I use sutures which do not need to be removed. However, these sutures could slightly stick out of the skin for a couple of weeks, and then they become loose and finally fall off themselves in 6 weeks. Now check the area of your incision each day. If there's redness, swelling, drainage or wound opening, inform your doctor immediately. Now these can be signs of starting an infection, and this is especially important if you are a diabetic patient. And hence it is important for you to keep your sugars under control. Keep the incision clean and dry. Clean water is good for surgical wound and does not cause harm. You will be given an ointment to help in healing of the wound. Now wear loose-fitting clothing that will not rub or irritate the incision area. Now after hysterectomy, the top of the vagina is sewn with stitches. A slight vaginal discharge is normal for up to 6 weeks, and that can even be blood-stained. You likely need to wear a pad or a panty liner during recovery for vaginal bleeding and discharge, but no tampons. Now, patients may experience menopausal symptoms like hot flushes, night sweat, and mood swings if your ovaries have been removed during hysterectomy. Now, if severe, doctor can prescribe medicine to relieve the symptoms. You may feel temporarily numb near the incision or down your leg, which is normal. Now, a word about activities which have to be resumed after surgery. Don't take it easy for the first 2 weeks. Avoid household activities that are strenuous or involve heavy lifting. Now, while rest is important, it is also important that you ambulate, as gentle walking will help with recovery. Then you can rest again. After 2 weeks, gentle exercise can resume if the surgery was laparoscopic. If laparotomy or open surgery was performed, wait for at least 6 weeks. Now, when you feel capable and no longer require pain medication, it's okay to drive again. Resist any straining for up to 8 weeks post-surgery, as it could cause discomfort or pain in the lower pelvic areas. That includes any chronic constipation or cough. Now, at 6 weeks post-hysterectomy, the surgical wound should now be completely healed. It's not unusual to feel weak or tired and have less energy. Any light vaginal bleeding or dark brown discharge should decrease by 6-week mark. Overall, most women will start to feel much better at the 6-week mark. Now, as far as activities are concerned, most women can return to work. Patients and their doctor will ultimately decide when they are ready to go back to work. You can gradually begin to increase the intensity of exercise as you recover. Now, 3 months after hysterectomy, by this time, patients should be fully recovered and back to their usual activities. Although it is not unusual to still be feeling fatigued or emotional. Now, research has shown that fatigue is the most common and longest lasting symptom that women have after hysterectomy. You can resume sexual activity or any work by this time. So, hope this video will take away all the apprehensions related to the uterus removal surgery. Do like and share this video if you liked it. Stay healthy, happy and informed. Take care.